And thank you very much for joining us here on PM Express for another edition on a day when there's a lot of scrutiny when it comes to schools that have been open for quite some time now in the midst of the COVID-19 pandemic. We're going to be talking about how to ensure safety in our schools. Now that we know that some of our schools are recording positive cases, we've seen the situation across, some of the schools where parents have panicked and had showed up to withdraw their awards from the senior high schools. It is one of those conversations that will allow you to ask your questions as well as a parent as we begin to answer a few of the questions to allay fears, but also to bring comfort and interrogate what the state is doing to ensure the safety of our children in the schools. And so we'll get to the details right now. We know that as we currently stand, cases of COVID-19, some senior high schools has sparked fears and panic among the public. There have been controversy over that. 6 students tested positive at the Accra Girls Senior High School on Tuesday. This is the story that sparked the concerns. We know that the Deputy Education Minister yesterday revealed 3 students at the Wesley Senior High School in Konongo also tested positive, and so this is also the case with the Accra Girls. Also, we know that there's been assurance from government that they're doing everything to protect the students. Specifically what that is, we'll get into that on PM Express tonight. Now, today a student of the KNUST Senior High School has died, not of COVID-19, at least we don't know that yet, but there was a COVID-19 fear which may have led to this. It sparked some disturbances in the school with students accusing authorities there of leaving the boy who complained of stomach upset unattended for almost 3 hours in the care of his own colleagues, because the officials and authorities in the school feared that that case may be a COVID-19 case. They didn't want to get close to the boy. The boy eventually died. So that is how it's linked to this. Now, parents and teachers are worried the schools are not safe for them anymore. The NAGRAT has warned that its members will not risk it if they feel they will be exposed by the school environment. We know one teacher has tested positive already. Now, the minority is asking the schools to be shut down because of these fears. We've heard today from the government side that says that really isn't possible. Now, Ghana's COVID-19 total count, and this is the broader context, stands at 29,968, almost 22,000. We are 891 new infections detected in 73 districts across the country. Now, there is positive news when it comes to recovery. 17,000 plus cases have so far recovered. The death is still climbing at 129 cases as of tonight. The key question to us is, how do we ensure safety in our schools in the midst of this pandemic, knowing that some of these positive cases have begun to emerge? We now know there's a timetable for the WAEC. Thousands of students will be writing exams. What are the measures to protect the children? Stay with me as we unpack these very essential matters for parents, for students, for school authorities, for teachers, all over the length and breadth of this country, here on PM Express. Stay with me. And thank you very much for staying with me here on PM Express. My guest in the studio is Dr. Kwabena Tando. He is a Deputy Director General of the Ghana Education Service. I'm grateful, Doctor, that you could join me in the studio. He agreed to join us in the studio because of the gravity of the issues, and he wants to take them on and help parents understand what is happening. It is only when there is no shortage of information that people believe there's transparency, that they can get comfortable with the situation. And so we're grateful that the GES has made itself available. And he's been talking all day on this great network, really. Also joining us tonight is Mr. Angel Kabonu on Zoom. He's the president of the National Association of Graduate Teachers. Mr. Kabonu, always a pleasure to have you on PM Express. We're also joined tonight by Salifu Dabre, who is a concerned parent. As you know, parents are really bearing the brunt of the anxiety. Many of them had queued to take their wards out in some of the schools. Hopefully they are hearing enough that may put them at ease. Dr. John Amoisi is a leader, Global Health and Infectious Diseases Research Group, and at cases here as well. Doc, if I'm not mistaken, the last time we spoke, you also had a child that day at one of the senior high schools, correct?
That's correct. It's a pleasure to be with you again.
Great. I mean, so I'll talk to you first as a parent, and then I'll talk to you as an expert in public health. I mean, so he brings that unique perspective to the conversation. I want to start, Dr. Tando. There's just some updates that I'm sure parents will love to know. We had the Deputy Minister confirm the 6 cases, I think, at Accra Girls yesterday. How many more schools have been affected by this?
Well, the same number as the Deputy Minister confirmed yesterday, which is 13.
13 schools?
No. 13 cases. Across 4 schools.
Across 4 schools.
Accra Girls, of course, is the main one that we discussed, but there's also Infantsipim. And then we have Konongo Wesley Girls. And then the 4th school is in Ahaf. We have 1 case. 1 case.
For the Infantsipim one, is it confirmed COVID-19 positive?
Yes, as the Deputy Minister discussed yesterday.
Okay, so, and I wonder though, because there's no mass, you're not testing students, so how are we detecting these cases?
Well, I would like to talk about the fact that our schools, which is our head teachers, as well as our teachers, have done a tremendous job. The teachers have really taken on the task that the students must come to school. There were certain conditions precedent that we discussed with our staff, our CHAS, as well as our teachers, that needed to be in place. Those conditions included ensuring that each school at least had thermometer guns, the schools were disinfected, that we had the basic PPEs in order for our teachers to be able to come to school. There was also the condition precedent that we must decongest our schools, and so for that matter, not all of the students can come into school. Then, we have been going through training with Ghana Health Service on the basic things that need to be done around checking students' temperature, just the wellness checks that need to happen in our schools. It is actually based on that wellness checks that our teachers and our school staff, as well as the schools' health, all the schools are mapped to a health facility. It is based on those wellness checks that we have been able to identify the cases that we have identified. Okay. If you look at the Accra Girls, which is really the main case that we are discussing, or we have been talking about in the media a lot. If you look at the Accra Girls case, and you look at the report both from the Ghana Health Service as well as from our school, it was very clear that as soon as the school identified that there may be an issue, the student was presenting with runny nose and dry cough. The student didn't even have temperature. But those things immediately alerted the school to then trigger the health professionals to take over and begin to do the necessary.
Okay, so I get what you're saying. So this is the symptom detection.
Yes.
Okay, this is then alerts the authorities to take the student out, do a test, confirm it.
Yes.
But I guess, is there protocol suggest once you suspect, you isolate? Does that happen?
Yes, all of our schools also have identified an isolation room. If it is a single-sex school, then they usually will have 1 isolation room. All of the mixed schools have 2 isolation rooms, 1 for boys and 1 for girls. And so what usually happens is that they will immediately do the isolation. And generally, our teachers are not health professionals. They are education experts. They teach. And so they will immediately hand over to health professionals. In the Accra Girls case that we are talking about, the Mamobi Clinic immediately responded. Dr. Questo has been very, very instrumental in leading the effort, identifying and doing contact tracing. And then in this case, the parents of the students that tested positive were communicated to. And I'll be very quick to say that we have already learned lessons from it, that there was a bit of a communication gap when it came to communicating to the larger parent group. And that is what caused some of the gathering of parents at the school.
The panic withdrawals that happened, people marching up the gates wanting to draw their kids.
Yes, so those are immediate lessons we have learned. And based on that, we are activating other ways to ensure that our communication gap is not created. Even in terms of communicating with our teachers at the school, making sure that our teachers are fully aware as to what is happening in the school. I think that this is a dispensation that all of us agree, parents, students, teachers, as well as administrators of schools. We all agree that, as we have heard so many times, we are living not in normal times. And as Ghana Education Service, what we have tried to do is to expand the consultative efforts in terms of how we operationalize the reopening of schools to make sure that it is as broad as possible. Okay. Where there are gaps, later, I wouldn't even say on a daily basis, on an hourly basis, we are constantly evaluating what we need to do so that we can...
If you may, before I go to my other guests on Zoom, if you can bullet for me the key COVID-19 protocols you put in place in the schools, just bullet for me.
Yes. Apart from the disinfection of schools, which was condition precedent, every staff, teaching and non-teaching, every student in our schools are entitled to a total of 3 nose masks. Okay,
reusable?
Reusable nose masks. They were delivered in 2 phases. The first phase was 2, and then as the president promised, a fortnight later, the 3rd will come. That's number 1. Number 2, social distancing in our schools. We have worked with our CHAS, which is the heads, to make sure that they divide their classes into no more than 25 students in a classroom. Okay, so ensure there is social distancing.
No school currently operating or in session should have above 25 students in the class.
25 students.
That is a directive.
Yes, and it is to ensure the protection of the students and most importantly, the protection of our teachers who must go in and out of those classrooms as well. So that's number 2. Number 3, each student, each teacher has been given at least 1 hand sanitizer as a backup to when they don't have access to water and soap. Number 4, each school has been given a complement of Veronica buckets, soaps, and the likes to make sure that they are positioned at vantage points.
This is stuff that you have to replenish regularly.
Yes,
you have made provision for this to be replenished
as and when. And we know that a lot of the schools have also even added their own complements. So maybe government may have given 20 or 25 Veronica buckets. A lot of the schools I visited, the schools also using their own resources have bought more. I have visited schools where teachers have even used their own to try to support what is happening in their schools. And we have also seen a lot of old students doing such. In boarding schools, the next protocol is also with dining. That for the most part, dining is happening in batches. You have a group of students who go, then after that, another group of students.
Are we concerned about the dormitories where they sleep?
Yes, our dormitories have also been, because you don't have your Form 1s, as well as in the schools that run double track, the Form 2 greens are also not around. You have a bit of room, maybe not a whole lot of room, because we have invited day students.
So you're having social distancing in the dormitories as well, where people sleep, etc.
In some of our best practices in some of our schools, there are a couple of schools I can think of my head, they have used a strategy that is really interesting. The students who are in Science 1 all stay in the same dormitory and use the same dining at the same time, so that if there is an issue, it is easy to contact us. We have seen that. I'm not sure.
I mean, if it works, why don't you make it?
Charles has communicated that to all of our heads, and my colleague and great friend Angel Kabunu can confirm if it is happening.
So that is a dormitory. So what else? What else is the other protocol? Is that
no sporting activities are happening in our schools. we are limiting visitors in our schools, and we are ensuring that these protocols are happening at very vantage points, including the gate of the school as students and teachers enter for the schools that have
let me bring in Angel Kabonu and my guests on Zoom. Mr. Kabonu, so quickly confirm for me the protocols that we've just had, elaborated. On the ground in the schools where your members are, how religiously are all these being enforced?
Yes, yes. The Deputy Director General is right. The Veronica buckets are there; they are being used. Hand sanitizers are there; they are being used. Yes, the dormitory arrangement was a novelty that some heads have taken. It was a very recommendable and very scientifically thought through. So I think Deputy Director General is right on that. Yes, management is done its best in providing the PPEs as were promised. The nose masks are reusable. Even some of the students, when they were coming to school, they came with their own nose masks, but they were also provided for by the Ghana Education Service and the ministry. As much as possible, students are trying as much as possible to adhere to the protocols. Though, of course, a few schools I visited, I had to ask students to go back to the classroom and pick their nose masks. There are, you see, the day students who were brought into the boarding house, you know, by the rules of the Ghana Education Service, all students who went to Form 1 had to go through medical checkup. And the medical checkup sometimes become more rigorous for those who are in the boarding houses. So housemasters and house mistresses knew students who had some medical conditions. Unfortunately, there was not enough time to scrutinize once again the day students who were being co-opted into the boarding house in the schools that do have boarding facilities. So, for example, the underlying factors, for example, the gentleman at KNUST was just ulcer patient, and I think we'll be discussing that because I'm getting some information right now from that school, from our representative, that I would like to share with the public.
I will come to that. I mean, that is one of the reasons why we had to have this conversation. It wasn't COVID-19 that killed him, but it contributed because from what the reports we got, the heads and the other authorities there felt with COVID-19, so they didn't quite act as swiftly as they should. We've heard that you've interdicted the head mistress. We'll talk about that because that sort of gives us a certain sense of what works and what doesn't, and what should change on the back of that lesson. I want to bring in Salifu Dabre. He's a concerned parent. Salifu, thank you for, again, joining me. So you've heard the assurances, the measures that have been put in place, etc. As a parent, are these, does this give you comfort and you can sleep comfortably knowing your child is safe in spite of COVID-19 in the schools?
Well, thank you so much for having me. I'm sorry I've not joined you on Zoom, but I've heard what the Deputy Director General for the GES has said, all right? But the measures, though on paper, it is absolutely excellent, but practically, we have a lot of challenges. Well, in the case of Accra Girls Senior High School, one will be surprised on Monday when parents have to mass up to the entrance of the school. You realize that the children rather uses the balcony of the school, and they are so crowded, and I'm surprised whether if there's somebody in charge. If you look at the way they are crowded in the balconies, you'll be surprised whether the school is in charge of the student welfare. What I would say is, if the students will be up and doing, if the school authorities will be up and doing, I believe formally we have what we call housemasters and house mistresses. Well, they can take charge so that they make sure that the students don't crowd themselves. If you look at, they are not observing the social distance. We saw some of the students on the premises of the school moving around. They are yet crowded. And I'm surprised whether we still have teachers or the school authorities who will be taking care of the students, looking at their movement, wherever they have to be at a particular time. All this, in fact, we've not observed it. But my biggest worry is that, like Dr. Tano said earlier, communication gap has been a problem. When we realize that this issue cropped up, especially on social media, people are, in fact, disseminating all sorts of information. Some of us, we try to get in touch with the school authorities to find out what is the real case on the ground, what is really the situation. And in fact, the school authorities were not able to communicate to parents, this is the situation. We also try to get our reps in the school, that is the PA, that is the parent association, and nobody is trying to tell us the real situation on the ground that has caused the massing up of parents at the entrance of the school on Monday. So we are saying that if, in fact, the school authorities will be in charge and then try to make sure that social distancing is observed, the physical contacting that they should not come closer to one another, it is also observed. In fact, if the school will do all this, I believe all that, in fact, we are fearing as far as this pandemic is concerned, that is COVID-19, I think we'll get a result. We'll get a result. So I'm advising the school that the school should be up and doing and make sure that, in fact, all protocols should be observed. By the students.
Stay with me on this, because as a parent, I'm interested to hear that view there. So the concern is that the protocols have been spelled out, but there's another question about enforcing and ensuring that they adhere to across the board. Let me bring in Dr. Moisi. Thankfully, he is a parent as well with a ward in a senior high school. Dr. Moisi, if you could talk to me for a second, just as a parent, when you heard the outbreak in the Accra girls, and then we heard the Konongo Konongo Wesley girls, and one other, I think you said in the Infantipim also. You heard these. What was your reaction? Immediate reaction when you heard these?
No, thanks, and good evening to you and to all your listeners, to the Deputy Minister and the Deputy
Director General. You seem to really get it. They say Deputy Minister. You know, I get it. Don't worry.
I'm going to get myself into trouble.
Yes, no. Yeah. So yes, as a parent, when you heard it, I mean, what reaction?
Yeah.
Emotions run through you?
No, I think this really raised a lot of concerns, and I must state that my ward is actually in the final year of the JHS and not in the SHS. Nonetheless, also a final year student who goes to school and then comes back every day, perhaps even a greater risk than those who are in the boarding house, because there's a whole range of interaction that will go on in that process of going to school, interacting with others, coming back home, and so on. So naturally, as a parent, I have great concerns regarding the risk that is posed. It was pretty obvious right from the beginning that we should expect this kind of phenomenon once schools are reopening. It was pretty much unavoidable. The fact is, once you are increasing the level of interaction among individuals, no matter how small that level of interaction is, you should expect an increase in the transmission of the disease. The quantum of the transmission is what is sometimes very difficult to ascertain. We also need to understand that measures like the Veronica buckets, the masks, the hand sanitizers are just measures to reduce risk. These are not foolproof. They are not guarantees that there will be no transmission. And I think this is a bit of a challenge with the general public, where there's this perception that once I have a mask on, once I'm using hand sanitizer, I am totally safe, like I'm so protected. But it's really not like that. It's only a risk reduction activity. Now, the question is, in reducing risk or in taking risk, how much risk is worth to take? Is it worth to take? And who faces this risk and who quantifies this risk? Going to school poses a risk. This is very clear. We have seen an increase in the number of cases. This was expected. what threshold have we set where we say beyond this, no more? And this is what I'm waiting to hear about, waiting to learn, trying to understand that what is our cutoff point, beyond which point do we say no more, we've got to take some other measures. I'll be really excited to hear about this from
in fact,
the Deputy Director.
that is the question I want to put you, because I've heard a lot of experts ask that question also. He's a health expert as well, as a parent. Can you answer that?
Well, it's interesting that he's asking us, because we are relying on the health professionals in terms of how we handle the situation. Our Director General has been very clear from the beginning. If you look at the joint press release that came out, that he's working closely with the health professionals. We and our teachers, we are educators. And we reopened our schools based on advice from the health professionals in terms of what we can do to ensure that we bring certain groups of students back into the schools. And we are receiving training in certain areas in terms of what we need to do around symptom detection and such. And we are relying on the advice of health professionals to look at, once there is a case in a school like we have in Accra Girls, what in terms of do we close or do we not close, that is a decision that the health professionals, after the assessment, will make that call for us, or at least recommend to us. Once they recommend to us, my Director General has been very clear that he would continue to listen to the advice of the health professionals. So just for clarity, so the approach is, in terms of whether to close or not close, you take it on a case or school by school basis. As at right now, yes. Okay. Now, what
based on advice of the health professionals you work with?
Yes. One of the things that in conversations in the past couple of days that I keep hearing, even from the health professionals, is that, okay, at this point you have a quote-unquote semi-quarantine group of students on a campus. If you have identified, say, 5 or 6 cases in the case of Accra Girls, before you can finish your contact tracing and know who is affected and who is not affected, if you say close and let everybody go home, you are increasing the risk for everybody, because the students will go in all directions. And so, just like at the University of Ghana, when the president instructed the closures of schools in the beginning, because they had some cases at the University of Ghana, the students had to wait for some contact tracing to be done before they could make the decision to allow them to go. So I believe that it is based on those same principles that we are operating. Once, of course, you are able to curtail any further spread, and the health professionals tell us that it is safe to continue going into school, that's what we do. I think it's also important to understand that we just reopened schools about 2 weeks ago, just 2 clear weeks ended last week. And so, and we do know, I'm not a health expert, but we do know from all of the information we have gathered that the virus incubation or gestation period is about 2 weeks. So it's possible that some of the cases we are seeing may have been brought from home or may have been brought from other places. And so I believe that the health professionals will look at the trend moving forward to be able to make a decision as to...
But back to the point that the question Dr. Moise is asking. At the policy level,
yes.
I mean, when you were talking about reopening, was there any conversation about, okay, at what threshold do we say, now we have to shut this down? Was there any conversation like that? And did the health officials advise this? I mean, has there been conversations?
There have been conversations around what do you do when we reopen and there are outbreaks, because there was the expectation and the understanding that just like the doctor just said, there is you cannot bring risk down to 0. So there were conversations around what is good, what is safe, what is not safe. In terms of a number, I can't remember where there was an absolute number, because an absolute number for, say, Prempeh College, which has, say, 1,200 students, may be different from Notre Dame in Sunyane or Fiapre, that has 320 students.
But another approach could have been, school by school basis.
Yes.
So if you take a school population, a threshold could have been, okay, if 20% of the school test, then we shut down. I mean, that could also be a consideration. Is that something that was also considered, or was?
Well, there were conversations around that, but I cannot recall that there was a discussion around absolutes or certain percentages.
But that's the question that the parent and a health expert is asking.
Well, but one other
it wasn't
thing
considered.
Yeah, one other thing that we do know that once the advice comes from health professionals that we should close, we will close. But we are also careful not to double communicate. Otherwise, people will be sitting there counting cases. And you don't want a situation that you have invited students to come back to school and they are sitting there counting cases. Am I going to write or am I not going to write? Is my school going to close or not going to close? And so we were careful to understand how do we ensure that the students also have a certain level of peace of mind as they come back to school.
But I wonder, what do you make of the suggestion, though, that we should have a threshold, if not at the national level, at this individual school level?
Well, I believe that it is a good recommendation for us to go back to the health professionals and say, what is your advice on thresholds? You know, rather than studying trends. What is your advice on thresholds? We are not health professionals, so the best thing will be.
So I guess the natural,
but it's a great recommendation.
A natural follow-up question, because you're the Deputy Director General, I know you hold regular updates on this. Is it something that you could promise the parents who are asking the question that you would at least consider? Definitely.
I believe that it is something that is worthy, and it's something that we need to be able to have that discussion. As a matter of fact, I am confident that my Director General will also welcome such a conversation. I believe that he would have that conversation with the COVID team as well as with the Ghana Health Service. So I can promise that those conversations will immediately begin. And if there must be specific policy changes, it will be communicated all the way down to the school level.
Dr. Moisi, now talk to me as a public health expert. So he's promised that a consideration be made. What should that threshold look like? What are the parameters? What should they be considering in making that decision?
The Deputy Director has made some really important points regarding their views on this and their reliance on health advice, which I think is really great. And I'm also excited to hear directly from him that they are willing to consider whatever recommendations would be put forward by health professionals. But I need to point out that when we talk about a threshold, we're not referring to counting of cases. Right? So we're not necessarily counting numbers of cases, because it's a function of a number of things, including, as you rightly pointed out yourself, the population of the premises, or the population of the school. The other thing also is to have an understanding of the spread of the disease. The important component there is testing. So the first challenge that we face is being able to conduct the test. Secondly, to get the results on time. Currently, there's a challenge with the turnaround time for receiving results. And if at the time when you receive a result, it only means that at the time the sample was taken, the person was positive, which would mean that the person would have been, if they had not been isolated, would have been spreading it to others. The challenge, which is a bit more difficult for us to deal with, is the levels of asymptomaticity. There's a number of people who will not show any symptoms. And as I've pointed out a couple of times already, people who are asymptomatic can also spread the disease when they are within that infectious space. So it's sort of a double whammy, one which we can control a bit by improving whatever testing regime has been put in place in the school for those students who may turn up with the slightest of symptoms. Some of the things that can be done are also the routine screening of students for signs and symptoms which may not always be very overt or obvious, such as checking for anosmia, which is a loss of smell, or ageusia, which is the loss of taste. These are slight things which sometimes individuals don't even point out, but if they are checked on a routine basis, can have an immense impact on being able to quickly detect someone who has the virus. So to cut to the chase, what I'd say is arriving at a threshold, as Deputy Director rightly pointed out, is supposed to be done on a school-by-school basis. It's a function of being able to calculate the rate of spread, or the projected rate of spread within that facility, which also be a function of the estimated number of contacts that an individual might have had within the school. Now, he made mention of something, or was it Angel who made mention of something earlier, which I thought was quite interesting, where he mentioned that people in a particular class are also confined to the same dormitory. So the argument would be that the association is at the level of the class and also at the level of the dormitory. So supposedly there will be limited interaction between classes, which would limit the number of people exposed if one person in a particular class should come down with the disease. It should be limited to perhaps those people within that class. Of course, this would not be foolproof, but it would certainly go some distance to reduce the magnitude of spread. So suffice it to say, before even this threshold can be determined, we need to put in place this testing regime, backtrack the screening regime, and as well as the testing regime for those who may show symptoms, as well as to be able to have a system in place where we can measure this rate of spread, so that if we arrive at that threshold, and I will go back to the proverbial R0, if we should set the threshold at a reproductive rate within that microcosm of the school, anything above even 1.5, you may want to consider taking further action. This is just a ballpark figure, because technically when you have an R0 of more than 1, then you're concerned about exponential spread. It doesn't necessarily mean that as soon as you cross 1, then everything should shut down. But let me just put it this way: once you begin to cross 1, then you can begin to get concerned and phase your measures through down to a closure if it's absolutely necessary. And we need to accept that there must be a place for closure if we go beyond a certain threshold. Great input always. And stay with me, Doc. Mr. Angel Kabonu, Salifu, I'll come back to you next. I'm going to take a quick break. When I return, we will look at the KNUST SHS case, but from the point of view of learning lessons from that, because it's a tragedy, but that we don't want repeated. We'll talk about that. Why the headmistress had been interdicted. What are we learning from there, and what lessons we could draw from that going forward. But also the big conversation about the WAEC examinations also that are set to begin. That is another key thing that we'll also talk about in wrapping up. Stay with me. Natando is the Deputy Director General of the Ghana Education Service. Angel Kabonu is the President of the National Association of Graduate Teachers. Salifu Dabre is the concerned parent, and Dr. John Amoisi is a public health expert and also a parent. Grateful gentleman. Dr. Natando, let's talk about the KNUST case. One person is dead, not to COVID-19, but what really happened?
The KNUST case, it's a rather unfortunate situation. And the first thing we'd like to do is to take the opportunity to express our sympathies from the Director General and on behalf of the Minister for Education, his deputies, as well as my Director General and all of us at Ghana Education Service. It is unfortunate. It shouldn't happen to anybody's child. It shouldn't happen to anybody in this prime of their life. So we express our sincere sympathy for that. What we do know at the moment is that a student presented with some stomach problems. Our initial understanding was that he is an ulcer patient, and there was contact made with the parents. There was some gap between the time the contact was made with the parents and when the parents showed up to pick up the boy. We have seen videos of what some of the things happened during the gap, but we don't know the full extent of everything that happened between that period. But the boy was taken out of the school by the parent, and unfortunately news broke that the boy had passed on. Obviously, his friends, his mates, and everybody was distraught. And so there was some unrest in our schools. Because they believe that the authorities didn't do enough. That's what the students believe. And even in the video, you know, I've seen just bits of a video that is, the camera kind of shift to look at two people that look like teachers. Obviously, they were dressed in, looked a bit older than the students, and that they were unconcerned. I want to quickly say that that is not the general teacher. It is rather unfortunate that this happened. Our teachers really understand the concept of in locus parentis.
Okay, so just explain. In this case, the headmistress has been interdicted?
Yes.
Why though? Because that is an important thing to clarify.
Right after we responded, with our regional director responded to the school. Obviously, any of our schools, when there is any incident, it's only the big ones that we hear on TV. But when there is any incident, there needs to be an investigation to ascertain what truly happened. And in certain investigations, certain people may not allow for an their presence. Not that they will not physically allow, but their presence may not allow for an independent, fair investigation. In this case, when the Director General received the initial reports, because he wanted an independent investigation, he asked for the head of the school to be interdicted. We want to quickly add that it doesn't mean that the head is at fault, but we need an opportunity to be able to conduct a fair investigation that is not, that nobody can interfere with, so that we can quickly have a report in a week or less to be able to ascertain what happened. Is it true,
from what at least some of the students have said, that the authorities were initially afraid that this might be a COVID case, and so naturally hesitated in giving the needed urgent care to the child?
At this point, what I can say is that it is an information coming out. We, Ghana Education Service, have not yet conducted our investigations. It has begun, but at this point, we cannot say that that was the case. But I want to quickly say that we know that stigmatization is one of the biggest problems we are facing when it comes to
COVID stigmatization. Around COVID-19,
yes. It's one of the biggest problems, and we have made a lot of effort to help our students, our parents, our teachers, and I've seen the Ghana Health Service and the Ministry of Information. There's been a lot of effort to try to get people to get past that stigmatization and the fear of the disease, and that if someone has it or the person has had it before and they have recovered, that somehow they are no longer part of society. So we still need to do a lot of work around getting people to appreciate, the experiences of people who may contract the disease and what it means when they recover, and the fact that they shouldn't be shunned.
Okay.
But I would say that because it is still a new disease, obviously we are still learning a lot about it, and so it may have contributed to it. But
let me bring in Mr. Kabono. Your teachers were there as well. What is it as a president? What have you been told also about this?
Well, I think that the school authorities did what was right. They called the parents. In fact, they called the mother of the boy. The mother of the boy indicated that she was a little bit far off from the school, and that they should call the father. The father delayed and took about 3 hours in arriving. Before the father arrived, the mother called back and advised that there is medicine in the bag of the student. They gave the student that medicine directed by the mother. The student took that medicine and vomited the medicine. The teachers even helped in getting him some malt to take. He took that malt and vomited until the father arrived. In fact, the father's initial insistence was to take the boy home, but he was advised, by looking at the situation and the fact that the situation was getting a bit worse, decided that they take the boy to, I think it was Menshia Hospital or something like that, where the boy died. Now, the boy did not die in the school, as the Director General rightly said. The situation is that some instruction given to teachers by health practitioners indicate that when you get somebody who is showing symptoms of coronavirus, You do not go about to pick the person or carry the person, but the first thing you have to do is quickly to alert health practitioners who are properly clothed, who are properly trained to come in and hand. That is the directive given to teachers. So, to be very honest with you, nothing untoward happened there because the teachers couldn't even, because one, the signs, we are all in a state of, we are all in a paranoid state with regards to this disease. And people are scared in the first place. You know, so I don't know why people are concluding. Let's look at pre-COVID time. We were taking students to hospitals at night. We were taking students in our cars to hospital before parents arrive later on, and so on and so forth. There are teachers in that very school who have taken children to hospital, prepaid for the children in the hospital. Parents have come to refuse to even reimburse the teacher for the payment that he has done. Yes, someone has lost his life. It is not the best. It is an unfortunate situation. I have a difficulty with the interdiction of the headmistress. I have a very serious difficulty with the interdiction of the headmistress. And I have been in the Ghana Education Service for a while, and I have never seen any headmaster or headmistress interdicted and is been able to come back to his or her school. It has never happened in the history of Ghana Education Service. Maybe this may be a novelty. We wait to see. But I disagree with the interdiction of the headmistress.
So what you want her reinstated? I mean, won't she be affecting the purity of the investigations?
Well, I don't even see this situation as a situation where she will want to even defend or protect anything. Because what actions how did she contribute to the death of the student? Was there something she should have done that she did not do? The schools are attached to health institutions. But are we sure that when the school authority picks a telephone to call that health institution, they have the personnel, enough number of personnel to rise to that school in relation to the burden of responsibilities that they have in the various hospitals? You know very well in this country that when you call an ambulance, the hours it takes for the ambulance to arrive, and so on and so on. I do not even know how the headmaster or the headmistress could be interested in interfering with any investigation. And investigation can go on, but I don't see this case as a case where any head of institution will want to interfere with anything.
That's Angel Kabonu's thoughts there. I want us to quickly return to the WAEC because they've just released the timetable. The first paper begins on the 20th of July. Now, there's a fundamental question that must be asked, though. I mean, as Dr. Moisi has said, going to school introduces risks. You can, at best, mitigate and reduce it. If you don't go to school, the risk is zero because the kids are not in school. I mean, they are home.
The risk in school is
zero. The risk in school is zero. But of course, I mean, I got home.
Yeah.
But I mean, that one, the parents will bear the problem. So why must the children be in school? Nigeria today has just taken a decision that they won't do the WAEC.
Is that credible news?
Yes, it's credible. Just on the National News Agency website, that they reversed the resumption of the schools and says no to WAEC exam for now. Why must we necessarily put these children in school when Nigeria, our big brother, says otherwise? Well, so they show that it's doable.
The question, the reason why I asked if that was credible news is because all of the West African WAEC member countries had all agreed to write the exam in August, September. All of them had agreed. We had communication to that effect. That while it was proposed that Ghana was the one that was going to write a Ghana exam, all of our member countries, in a response from WAEC to the Director General, or through my Director General to the Honorable Minister, was that all of our member countries, and all of our member countries means all 5 countries, had agreed to write the August-September exam. So that's why I ask if this is credible news.
Yes.
We have not received any communication officially to the contrary. And we usually, we receive our communication from WAEC through official channels at the Ghana National Office. And so if there is something in the news media, we would at least wait for official communication. But as far as we are aware, all member countries have agreed.
I just pulled out the BBC report on this, and they confirm, and this is just today, by the way, at 18:24 p.m., which is literally a few hours back. Yes, that Nigeria says they will not participate in the West Africa Examination Council if it resumes now.
Okay, we will wait for the official communication from WAEC office on that. But what we do know is that usually...
So if this is confirmed, what does it do? Does it change anything?
It doesn't change anything because...
Ghana will also go ahead with that Nigeria. I mean, because Nigeria has possibly the biggest population
Nigeria is still
students.
One of 5 countries. There are 5 members. They all have equal votes. And so we have had instances, for example, in 2013 when we had the Ebola crisis. The rest of the countries, when you have a majority of the countries saying they are going to write an exam, the rest of the country goes ahead. WAEC makes specific arrangements for countries that are unable to write. And so I believe that with Nigeria making that decision, once we receive the communication, it's not going to change our...
Ghana will still go ahead with the rest of the WAEC countries?
Yes.
Without Nigeria?
And that has happened before. Sierra Leone had to wait, Liberia had to wait, but Gambia, Ghana, and Nigeria went ahead and wrote.
I'm grateful that you joined me with this, Dr. Moisi, and thank you, gentlemen, for joining me. We haven't finished this conversation. We'll have it again because the parents will need constant updating. I'm grateful that you've been spending your time with us the whole day. Enjoy the rest of your evening.